Despite having various theories, we do not know precisely as to how our remedies work. However, we all have a common understanding that our selected remedy shall produce exact similar but stronger symptom already existing in our patients, thereby removing the original symptom. So, basically, to cure a patient, we hunt for a remedy that has the ability to produce exactly similar but stronger symptom already existing in our patient. For this, we depend upon the information given in our Materia Medica and repertoire. Now, what is the source, or from where did all the information given in our Materia Medica and repertories came from? Basically, there are two sources: 1, drug proving, and 2, clinical symptoms. We all know that proving of the same drug is done on different individuals, and it is also clear that each and every symptom given under a particular drug was not observed in every prover. So, it is very clear that each and every symptom recorded during proving were not produced in each and every healthy individual on whom the proving of that particular drug was done. So just think for a second when we suggest or prescribe remedies based on one or few symptoms, or on clinical diagnosis, or just by seeing a photo of the disease ultimate. On what basis we expect that the drug will produce that symptom unconditionally in each and every patient who is sick? Now, regarding the second source, that is, the clinical symptoms, let's read from the book to understand the definition of a clinical symptom. Clinical symptoms of a drug represent symptoms which are not found during the proving of the drug, but were found to be cured in clinical practice. So, it is clear that they are least reliable. Now, how fair it is to depend on something that is least reliable while treating a patient? Are we trying our luck upon our patients? What right we have to play with the health and life of our patients? Despite having existed for over 200 years, we still face critics, mainly because majority of us prefer to depend on their luck rather than working hard on each and every case they get. Under the sweet name of clinical experience, we are happy to make excuses, but it must be remembered that experience can only confirm the law and our basic principles. An experience of any number of years shall not hold more weightage to deny or replace the law and our basic principles. Homeopathy is a complete system, and for the same reason, it should yield the expected result in each and every case we get. Those who are happy with 50 or 60% results and are busy in prescribing based on few handful of symptoms, clinical diagnosis, shortcuts, tips, clinical symptoms etc., are not just making a mockery of themselves, but of the entire system, giving others a chance to laugh at us. Learning is a never-ending process. Age, years of experience, or any other excuse should never be a hurdle for self-correction and learning. Especially when we are playing with the health and life of our patients, it becomes our moral responsibility to give the patient what he deserves best. If we all can develop such a kind of attitude, not just we ourselves shall grow wiser, but it shall also take our entire system to a level where homeopathy will be the first choice when it comes to serving the healthcare needs.